Hey, how's it going, everybody? Mike here with another video on my ACDF journey. So today is week 5 post-op. It's crazy. It's crazy that I'm at week 5, and it also is crazy that I'm not at week 6. But anyway, I wanted to just make a quick check-in video on the progress. Next week, I go for my 6-week follow-up, and we'll see what the PA says about possibly losing the collar. I don't have the collar on right now, or the neck brace. I don't have it on right now, but I still have to wear it for most of the time. They did kind of clear me to take it off when I'm just kind of sitting in one spot. So that's what I'm doing right now. And so I have it off. But moving around and doing other things, I still have to have it on. So, quick update. Let's see. So I'm still doing pretty good. It's a roller coaster, as I probably every single one of my videos that I've done, I say that because it is. So if you are contemplating having this surgery done, or if you've just had it done and you're wondering what happens in week 3, 4, and 5, I will tell you weeks 3 and 4 were pretty rocky. I think I skipped last week, so I didn't do a video last week. So I have a 3-week video, and then now I did the 5-week video. But just rocky meaning like all of a sudden, all your muscles start hurting again, and it's kind of interesting, like how it goes through the cycle of things. So in now that I'm in week 5, going into week 6, I'm still having some muscle pain here on my left side. It's mostly up in here. It is going kind of still down my arm. I don't know if the nerve is still aggravated or it's still working its way out. So I'll talk to them about that next week. But it is kind of annoying. Sitting is probably the worst thing you can do, and unfortunately I sit in front of a computer for my job, and I try to get up as often as possible, but sometimes you end up sitting there longer and you don't realize it. So that's not good, but ultimately I can loosen up if I start moving around, and it'll get a little bit better. So that's like the and then there's still some soreness in the upper back, but and obviously the sides of your neck. This is if you're wearing the collar like me, pretty much all day, every day for the last 5 weeks. These muscles are getting pretty aggravated with doing that. So we'll talk to them about that next week. I'm fully expecting to let them for them to tell me that I can lose the collar, so that'd be great. Maybe they'll have me wear it in certain occasions, but I think for the most part I won't have to, depending on whatever. So we'll see what happens there. Really, again, like I think in all the videos, the biggest challenges for me are sleeping. It's so hard for me to sleep with that neck brace on, and you have to sleep on your back, and I just don't get good sleep at all. I can't sleep for more than a couple hours at a time without waking up, and the back of the brace, it kind of digs into your spine which is kind of interesting because you're not supposed to be upsetting your spine, but yet you're wearing this collar that you're laying on that pushes on your spine. So I don't really understand it. So I don't think that's a big issue, but it makes it even more sore on your vertebrae. So that's it. Other than that, I guess I'm doing pretty well. Still doing my walks, 3, 4 times, actually 4 or 5 times a day. I kind of scaled it back. I was doing a lot of miles. I was probably doing 8 miles a day in walks throughout the day. So that was like 5 walks at least, maybe 6. I scaled it back to 6 miles a day, and that just is, it's about 4 walks. Roughly 4 walks. Maybe I'll slip a 5th one in there, but keeps me around 6 miles, maybe a little over, maybe a tiny bit under. And I only scaled it back just because I thought maybe I was just doing too much, and my body was getting a little tired. So anyway, that's what I did. So that's really it. Again, I mean, could it be better? Yes. The pains that I'm still having in these muscles is super annoying, especially on this side. It's really, really like tight, and it's a lot of sharp pains going on. And all I'm taking is the Tylenol muscle for that, which I'm sure I've said in one of my other videos. So next week we will see the PA, and I'll do my follow-up. And I don't think they're going to do x-rays because I just had a CT scan like a week and a half or 2 weeks ago, something like that, and they said it looks great. So I don't think they want to put me through any more radiation this time. So we'll see what they say. Other than that, that's all I have to report. So leave some comments, ask me some questions, whatever you want to know. You know, we're nearing, once I get to the 6-week mark, I think everything's going to get better, but then you still have the second 6 weeks, till you get to the full 3 months before they kind of lift you of everything. So I will do a video next week after my appointment, and I'll give you guys an update on what they say and what to expect, for the next 6 weeks moving forward. And hopefully it's going to be a cakewalk, and I'll actually be able to get some real sleep. So again, leave some comments or questions or anything you'd like to know, and I'll try to get you some answers. Other than that, thanks for watching.